Super well. Welcome, everybody. My name is Dr. Heath McAllister. I first just wanted to introduce myself. I'm a naturopathic doctor. I've been in practice for 15 years, specializing in alternative therapies. We do a lot of regenerative therapies, IV therapies, stem cell treatments, peptide treatments, all kinds of different things. That's been my focus for the past 15 years. And I am happy today to talk to you all about exosomes and peptides, which are the two most exciting topics that I've experienced as a physician in recent times. That I don't, these are things that are not going to go away. You're going to hear about them more and more as time goes on. And I want to kind of tease them apart and demystify what are they and how do we use them? How do I clinically think about them? How do patients get benefits from them? So firstly, I just wanted to go over what they are, what the basic definitions of them are. I'll start with peptides. So peptides, it's a term that you're going to hear a lot more and more of. They refer to short amino acid chains. So a long chain of amino acids that's coiled around itself is we call a protein. So one way of thinking about peptides is they are short proteins that have strong physiologic functions inside the body. So we have examples of peptides that are already bioactive in our bodies. One common example is insulin. Insulin helps us balance our blood sugar, and it is a small amino acid chain that helps unlock our cells and let sugar inside of our cells and really controls a lot of our sugar metabolism. There's a whole bunch of other peptides that our body makes, and probably one of the most famous ones these days are called the GLP-1 peptides. It's a glucagon-like peptide 1. So that is a naturally occurring peptide that we make in our own bodies that helps us balance blood sugar and has really fueled the whole Ozempic craze right now, which Ozempic is a GLP-1 agonist, as is Mounjaro or tirzepatide. Those are hugely popular drugs, and people have finally realized that these peptide therapies are strong, strong signalers inside the body, and they do great many things. Lots of different things can be accomplished with peptides. Everything from healing strains and sprains to losing weight to balancing the immune system to increasing muscle growth. So peptides are a really incredible emerging science. Lots of great things happening with peptides. And I'll go into a little bit more of how I think about peptides and who's a good candidate for peptides and some specific names that you might have heard of out there. But I also want to talk about exosomes. So exosomes are not exactly a household name, but they are the cutting edge of regenerative medicine. So exosomes, similar to peptides, are a signaling molecule. They are a signaling molecule produced by stem cells, and they are kind of their function in being produced by stem cells is to signal to neighboring cells to perform certain actions. So it's a signaling system called paracrine signaling. And it's something that happens in all of our bodies and is happening in all of our bodies right now. However, if you take really high quality exosomes, meaning exosomes from mesenchymal stem cells, the most potent and most viable, most vibrant stem cells that we have available to us. If you extract the exosomes from those cells, you have incredible healing effects. So anything from healing joint degeneration, knee problems, shoulder problems, tears, sprains, arthritis, healing skin injuries, healing up scarring or rejuvenating the skin. Also being used as an IV treatment to rejuvenate organ systems. So the heart, the lung, the kidney, the liver, all of those systems can be rejuvenated by these strong signaling molecules extracted from stem cells. So, in terms of their regenerative ability, I think, if I think about peptide versus exosome, uh, exosomes are king. There's nothing stronger that I think we might never come up with anything stronger than exosomes. They are the king rejuvenative force in modern medicine. And I think in the future we're going to see people growing new pancreases with exosomes and reversing Alzheimer's. And we've already seen in our clinic a great many uh, essentially medical miracles with exosomes. That if you imbibe that primordial essence that creates life, which is what exosomes are, you can have miraculous things happen. So they're extremely powerful. Also, there's some challenges in how to think about them. Both peptides and exosomes have their own considerations in terms of who should use them and how we should use them and what risks and what benefits are associated with them. So, uh, I'll go through, I have a PowerPoint that I'm going to go through right now, specifically on exosomes, but then I'm going to dovetail back into peptides. So let me get this up. There is our slideshow. Okay, so this is exosome therapy. So exosome therapy, this is what we're going to talk about in this slideshow. What are exosomes? I just kind of gave a little Cliff Notes version of it, but they are essentially membrane-coated vesicles that contain a payload of DNA, RNA, and proteins. And I would term those micro DNA and micro RNA. Those are instructions to your cells to create certain proteins. All human cells can and do produce these, and they function to communicate to neighboring cells. Well, what do they do? Well, it really depends on the source. So basically, an exosome takes up the characteristic of its parent cell. So if you have a really incredibly vibrant parent cell, like a mesenchymal stem cell, then the budded off exosomes that are produced from those mesenchymal stem cells are going to be very similar to the parent cell. So they'll have that vibrance, that ability, that extremely potent ability to rejuvenate and to cause deep healing. So the ones that we use at my clinic are all from mesenchymal stem cells. You can get these from bone marrow. You can get exosomes from bone marrow. You can get stem cells from fat tissue. There's various different ways you can extract both stem cells and distill exosomes. And the one thing that I would say is that the quality is king. That if you have high quality exosomes, they're going to be doing that incredible job of healing. And if you have low quality exosomes, it doesn't matter how many you give, they're not going to have the same effect. So exosomes versus stem cell. I get this question a lot, because the stem cell treatments do exist. You can harvest stem cells from your own tissue. You can also get them from mesenchymal stem cells from healthy placental, healthy born babies. Placental tissue have mesenchymal stem cells. So, when to do which. So, they're similar in the sense, like I said, exosomes derived from mesenchymal stem cells are going to have a lot of the same quality. So, why not just use mesenchymal stem cells? Well, we'll get into that in a second. Another way to think about exosomes are little packets, little packages, Amazon packages, right? And do you want an Amazon package? Do you want it delivered from Staples, like something like paper or pencils, or do you want something from Cartier, like a really high-end brand? Now, that's the difference here. Do you want something that's from Walmart? Do you want something that's from, a gourmet grocery chain? The quality is king. So. But in terms of, and I don't know if I go about it here, but no, I don't. I'm going to talk about why would you do exosomes versus stem cell? So exosomes are a pure distilled product. They are the signaling molecule that creates that tissue sea change in our body. Now, if you take stem cells, let's say you take mesenchymal stem cells from your own body. You can do that. You can take it from your bone marrow, you can take it from your fat tissue, and then you inject it into circulation. Well, if you do that, fine. They do have benefits. There are clinics that do that. Now, the issue that I have is that, well, they're not beginning of life stem cells. In myself, it's a 48-year-old stem cell. Well, that doesn't sound as attractive as day zero stem cells. Day zero stem cells create life, right? Day 48, or year 48 stem cells, yeah, they're not as good at doing that. So that's one reason why I think, using your own stem cells may not be as beneficial. However, if you take stem cells from a healthy born baby, or a healthy placenta, those cells do produce exosomes, but they're not your tissues. And our bodies all have a name tag that tells that this, I am Dr. McAllister's cells, and you are, your cells. And if you cross-pollinate those cells, your body knows they're not your cells, and after a little while kills them. So even though you can take mesenchymal stem cells from another person or a placenta, rather, they're not going to translate into viable cells living in your body for any amount of time. The only reason that the benefits have been shown from those stem cell treatments is because while they're in circulation, they produce exosomes. So what are the benefits of exosomes? Why do we care about exosomes? Well, there's been hundreds, probably at this point, thousands of studies on exosomes from all kinds of different walks of life and different conditions. And they've found generally that they're anti-inflammatory, they have an antioxidant effect, Antifibrotic, which means they break up scar tissue. Immunomodulatory, that means they balance the immune system. So if it's too high functioning or too low functioning, it will balance the immune system. They improve blood flow. So if you have impaired blood flow to any parts of your body, which is really common in diabetics, or as we age, we get less blood flow. They're anabolic in nature. So this is a great term that means helps promote building of tissue. So if you want to rebuild tissue or build healthy tissue, you need that quality of anabolism, which testosterone does and growth hormone does, and exosomes do. There's general regeneration healing, so all kinds of tissues that applies to. That can apply to joints, it can apply to skin, it can apply to organ function, and generally are considered to be anti-aging in terms of turning back the biologic clock. That's why we care about exosomes. The anti-inflammatory aspect is really well researched. This is what happens when you inject exosomes in different painful joint areas. You get a decrease in all of these major inflammatory markers. The interleukins, the TNF alpha, which stands for tumor necrosis factor alpha, supremely inflammatory. So all of these different inflammatory markers go down and it upregulates anti-inflammatory markers, the IL-10s, the IL-4s. These are things. So by virtue of these two mechanisms, you're decreasing inflammatory markers and you're upregulating anti-inflammatory markers. So when we have overt inflammatory conditions like acute injuries or autoimmune diseases, or hugely important for those people. Antifibrotic. So look at this. Healthy tissue. We've got a nice, healthy, see all the tissue threads are nice and stacked out how we like them. And there's some nerve, artery, and vein passing through them. And when you have scarred tissue, it's all messed up and there's coils of different types of fibers and elastic and scar tissue. And then when healed scar tissue is like a matrix. It's formed, it's stabilizing the area. Well, exosomes will accelerate the wound healing. So like stabilizing an area that's compromised and remodeling it and then helping reabsorb and soften that scar tissue. Exosomes are immune modulatory, so they are going to help balance the immune system. So in cases where we have under-functioning immune system or over-functioning immune system rather, are autoimmune diseases. So that's anything from rheumatoid arthritis to Hashimoto's thyroiditis, lots of different conditions where the body has lost tolerance of your own tissues and attacks. And that's extremely destructive for the body. So there's been a lot of research on showing that exosomes have the potential to calm autoimmunity into quiescence. And a lot of that can be modulated by T cell and macrophage activity, which are two types of your white blood cells. Proangiogenic, so this refers to creating new blood vessels. And we talked about anabolic, that term of just creating tissue in general. So exosomes do stimulate growth of new blood vessels, and wherever blood vessels occur, now you get greater flow of nutrients to an area and greater waste removal. So for struggling tissues, that's really important. And specific cells like fibroblasts, they are the ones they're the loom of the body. They're the tailors. They create all these threads of new tissue and help support things like ligaments and cartilage and collagen production of the skin. Anti-aging. So exosomes have been shown to improve cell longevity, literally cell lifespan, which is longevity. If your cells live longer, you are made up of your cells. By extension of that, you live longer. Now, how much longer will you live if you get an exosome treatment versus if you didn't? There's no way to know that, but definitely there's been a lot of animal studies that have shown positive benefit of longevity when taking exosome treatments. So what are the risks? So no treatment is without risk. So obviously, if you're getting some type of injection into your body, there's always a risk because that's a procedure. So if you're getting a joint injection, if you're getting, into the muscle, there's just the risk of you're being poked with a needle. There's a risk of infection whenever you break the skin. Now, the exosomes themselves are highly purified, so it will not cause a hypersensitivity or rejection reaction because they are not cells. They do not have the name tag that says they are from somebody else. They don't have that name tag. They're too small. They're microscopic, which also means they can get places that are hard to get to, like up to the brain and stimulate brain healing. So we don't know with cancer. We're not sure yet. There's been some, speculation that it may be helpful if someone has cancer, but for liability's sake, we don't go there with cancer. So cancer, if someone has active cancer, we don't recommend an exosome treatment. And then if you have a chronic infectious disease like herpes, mononucleosis, or Lyme disease, those have been observed to flare just after an exosome treatment. So if someone has those conditions, they doesn't mean you can't get an exosome treatment. It just means that you have to bracket it with some other suppressive treatment so that you don't suffer, while you're getting the benefits of the exosomes. So exosomes are used in a variety of ways. You can do them facial treatments where they're basically applied to the skin and embedded with a microneedling device. Joint injections, done lots of these. You can inject right into a joint, and so you're concentrating that healing power specifically where you might want it to be. Intramuscular injections, you can give them just as a shot into the thigh or the butt or the shoulder. And they have found that if you give exosomes in a shot like that, you'll get all these downstream benefits in places you never expected. Like you'll see heart inflammatory markers decrease. You'll see liver function improve. You'll see all these different organ improvements just from introducing it into the muscle. It's going to have this kind of cascade effect into other areas. IV treatments. Now, if we want to actually distribute the exosomes to a wider, array of tissues in the body, that's where we think about an IV treatment. That's where it gets introduced to your bloodstream. Your bloodstream is the most efficient way to, conduct things through your body, and therefore the exosomes can potentially percolate through any of your tissues and have that a strong healing effect. There's a couple other things that are done. Intrathecal injections, that would be injecting right into into the spinal column. So that would be into the cerebral spinal fluid in hopes that it gets, get up to the brain in a more efficient way. No, we don't do that at our clinic. That's considered, I would refer that out if someone really wanted that. Editorially, I would say I don't think it's that necessary, that the IV treatments are a really effective way to distribute exosomes throughout the body. And we'll see in one of our case studies too that they definitely can affect brain function really well. And then, ultrasound guided targeted treatments, we don't do that either. That a lot of times that's used for when people are injecting again to near really, really potentially dangerous areas. Then you want to have a little more guidance. And in our clinic, we just don't do we refer that out. So what conditions can exosomes potentially treat? Well, if someone's worried about aging, rapid aging, or they want to stay as functional for as long as possible, there's nothing better. Someone has an autoimmune condition. How do we get the immune system to calm down and reset itself? Exosomes are a powerful tool and can potentially help with that. Any tissue degeneration, so wounds, post-surgery, sports injuries, arthritis. Everybody and their mother is going to get arthritis. If you live long enough, you're going to get degenerated knees, hips, ankles, shoulders. And so this rejuvenates those things from the inside out as an alternative, potentially, and a lot of times you can get away with that rather than doing surgery. So that is huge because surgery comes with a whole other suite of issues in terms of scar tissue and rehab and so forth. Inflammatory conditions, again, organ specific issues, autoimmune conditions, chronic diseases. I didn't mention, but diabetes and insulin resistance. Exosomes are excellent for helping our metabolism function better with regards to blood sugar balance. And all these different organs and many, many more will be helped with exosomes. So anyone concerned about their health and longevity, anyone with autoimmune conditions, anyone with sports injuries, post-operative recovery, facial rejuvenation, organ pathologies, these are all excellent candidates. All of us essentially can fall into one of these categories at some point in our lives. So I think almost everybody is a great candidate for this treatment. Here's where I talk about the difference with stem cell and exosome. We did go over this, but stem cells, if you take them from a foreign place like a placenta, those cells will not live in your body. The only hope is that they will secrete exosomes in the short time that they live inside your body, but they don't become you. Whereas your own cells, if you do harvest them and put them in, they are you, so they are going to integrate into your tissues. And the only other thing I would say about if someone's interested and wants to do a stem cell treatment versus exosome treatment, stem cells they have to be really it has to be a pure product. If you take mesenchymal stem cells and inject them, great. They're they do have a function. However, if it's not kind of purified enough, if there are white blood cells that tag along with those at mesenchymal stem cells, you can have a huge inflammatory, awful reaction. And that has been documented in the literature. There have been people that have had those reactions, and I wouldn't wish that on anyone. So again, for another reason, what that I would recommend doing exosomes versus stem cells. So, when I think about exosomes, I think they're cutting edge. They're the reason stem cells work. They're more concentrated, they're cleaner, they're safer. It's like flicking a domino. It's a cascade of effects that are used. So at our clinic specifically, we do exosomes. Really depends on the concentration, but this is we're really upfront about our costs. If people are doing facial treatment, usually it's going to be a $3,000 treatment. So these are not inexpensive treatments. Exosomes are not like, hey, everybody's going to be a candidate for them. You have to have that disposable income for them. It has to be worth it to you. In joint injections, it can be anywhere from $6,000 to $8,000. Really, 3 to 8, that's your price range for exosomes. And the reason I say that, and you can get cheaper exosome treatments out there, I would just be wary of that because you get what you pay for in life. If you get cheap exosomes, usually those are cheaply made and they're not going to be as effective. We use this brand called Chimera. They're the best of the best. And so most people go do either a 5 billion treatment or a 15 billion treatment, and that costs us $6,000 or $8,000. And this stuff is worth its weight in gold. Um, Anyone who comes to us for our exosome treatments, we go through full informed consent. We want everybody to know what they're getting and feel comfortable with that. When we're giving the exosomes, we start an IV nutrient solution if we're doing an IV treatment. And while that IV solution is dripping, we thaw the exosomes. They have to be stored in frozen temperatures in order to preserve their potency. And once it's thawed, we inject those exosomes in the line and they're in the system where they can have immediate effects. So let's just talk about a few case studies here that I think are useful to talk about. So 57-year-old man, this is my patient here. 57-year-old man, torn labrum and biceps tendon. So this is essentially a big time shoulder injury. This guy had been doing a lot of, swinging his arm. He was doing various different arm movements like pitching and so forth, and had really ground down the labrum, which is that fibrocartilaginous cup that holds your arm into your arm socket. And he had ground that down and ruptured his biceps tendon, which is pretty tough. We gave him a single exosome and PRP, which stands for platelet-rich plasma, single treatment. And he reported to me 6 months later that he got a repeat MRI. No evidence of any tearing was seen, which is pretty dang good. You can't ask for anything more. His other option was doing like shoulder replacement surgery or, some type of shoulder anchoring. I mean, like those are not good options. Okay, other case studies. 37-year-old female who had not had a period on her own in 4 years. So she had what we call amenorrhea. She was not able to cycle. And that's because the part of the brain that signals that cycle was not working. 1 year after exosome treatment, she started having periods again. So clearly, this repaired the brain, the part of the brain that had been degraded and was not functioning. Exosomes did go up through the blood-brain barrier and heal the brain. 42-year-old female gets exosomes pretty often and now is symptom free. Had terrible, terrible fatigue from Lyme disease. I mean, pain throughout her body. Has done several treatments, very much more intensively than some other patients might need it. And she's got her life back. So giving someone's life back, there's no better payoff for that. I mean, it's just the best thing. And then a 45-year-old female had arachnoiditis. So this is a really weird and rare condition. I had honestly never heard of this before. I talked to this patient, but it's basically inflammation of the coating around the spinal cord, and that coating can get inflamed. And so she had terrible pain and couldn't hold her urine and her stool and had headaches, trouble walking. I mean, it was total neurologic symptoms. She had 2 treatments and she was 80% better. 80% better, which coming from, this kind of trouble walking, couldn't go out in public because she might have an accident. I mean, that's huge. That's huge for somebody. So I wanted to share that in terms of the power of exosomes. Now, I want to shift gears again and talk a little bit more about peptides. So, because peptides, a lot of the things we've talked about so far, peptides, with exosomes, and they're signaling molecules. They help the body to heal. They can be used for various different ways. Okay, but that sounds also similar to peptides, and that's true. there's a scale difference. I did mention that exosomes, in my professional opinion, are the most potent and the most amazing, most powerful of those regenerative treatments that are out there, and I still stick to that. Peptides are the second in command, though. They're still amazing. They're incredible signaling molecules in the body. Peptides, you know, have a wide range of potential uses, everything from also helping to rebalance the immune system and helping injuries heal and helping, but even more, and anabolic in nature. Some peptides are strongly anabolic and can help patients gain muscle. Peptides are the difference. The main difference I would put this. Exosomes can help completely overhaul a system that's broken. Let's say your car won't start. You need a new engine, okay? Exosomes can potentially heal the engine, okay? With peptides, let's say, your car's not working, you're using peptides. Peptides will help the car function for longer and, help it work better. It's like giving the car high octane gas and changing all the fluids and so forth. It is helping, but it's not giving you a new engine. It oftentimes it will not completely correct a failed system. That intensive work I do reserve for exosomes. But if you're having to like repair brake pads or spark plugs, peptides can do that. And peptides are much less expensive. So peptides are anywhere from, say $500 to $1,000 versus $6,000 to $8,000. Okay, so there's a scale of price and what you're looking for. What is the net effect you're trying to get out of it? That's what helps me guide exosomes versus peptides. And I will say they're not mutually exclusive. In a lot of cases, I use exosomes and peptides together. Particularly if someone's doing an exosome treatment, that is a strong recommendation of mine. You can follow with a course of peptides and you can essentially extend the action of the exosome treatment. And you're talking about adding on a few $100s versus you've already spent thousands of dollars. So oftentimes I will combine those and see really wonderful effects. Now, how are these both taken? We talked about the exosomes. Exosomes are not orally available. They're only injection or topical. You can't swallow exosomes and get anything out of them. Your body would just dismantle those. Peptides, some peptides can be taken orally. There are oral ones like BPC 157 that does have oral effects. There's a subunit of thymosin beta 4. That's another type of peptide. Those are two peptides that have some bioavailability if you take them orally. Otherwise, they are injected. They're injected mainly as an intramuscular injection or a subcutaneous injection. So, for people that have issues with needles, these aren't really your treatments. They're in order for them to preserve their function, they need to go into the bloodstream intact. So there's a lot of information there. I talked a lot about exosomes. I did skim over some peptides, but I would say that peptides, again, are a very exciting area of research. And we're just seeing the tip of the iceberg with the GLP-1 peptides, where there's so many more that are being developed and have really wonderful effects for healing the brain and, decreasing inflammation, improving scar tissue or resolving scar tissue. Peptides are fabulous. Exosomes are fabulous. They're so exciting for me as a doctor to have these at my disposal. They're such powerful tools. And, I think most people, at least from middle age onward, are great candidates for these treatments. And in terms of a cost benefit analysis, there's very low risk of anything bad happening to you, and there's a huge potential benefit. So, so with that, I will stop and take any questions that anyone's got. So, do I have any questions for anyone? And if not, that's fine too. I will be post. Let's see. Let's see. I do have a question that just came in. Can you have multiple exosome injections in different body parts in one session? Yes. I usually limit that to two. And the reason is the exosomes themselves don't heal you. Your own body heals you, but in order to heal you, you have to recruit vitality. And so if I do more, I can do two. Like I'll do two knees, I'll do a shoulder and an ankle, I'll do an IV treatment and a neck. I'll do two. More than that, I don't want to dilute the healing effect. I think if you did, it's safe. You could do four, but I don't think you'd get a great treatment result. I think two is the max that I would do. Two body parts on a session. I've seen that be very, very effective. But beyond that, I think that you're better off spacing those treatments out. You're going to get a better treatment. Great question, though. Great question. Okay, any other questions from anyone else? And if not, that's totally fine too. I will be posting this talk. I'll send it out in the newsletter. I'll also send it on my YouTube channel. So if anyone wants to review it again, you can see it there. Really grateful for everyone who signed in today. And I will be trying to have these informational talks monthly. And each month, I'll have some common information, the basics, but then I will go into other information that I want to share, highlight certain aspects of exosomes, and I'll definitely revisit peptides. So if this was at all interesting to you, stay tuned. And next month, we'll have another talk like this. So hope you all have a wonderful day. And Thanksgiving's coming up. Oh, I just got another question come in. Do you need to see any kind of imaging before injections? Sometimes, yes. Look, imaging's always great. Imaging is always fabulous. Will it change the treatment? Sometimes. For a shoulder, there's different injection approaches for different areas that you're treating, for instance. In the knee, it's mainly pretty straightforward. So it really depends on what you're treating. Obviously, if you're doing the IV treatment, that's an IV treatment. But if you're doing a joint specific treatment, having imaging is always helpful to guide us, to make it as most specific as possible. At the end of the day, when you're treating things like, musculoskeletal injuries, you're going for the painful areas. The painful area is the area that is hurt, that needs to be repaired. So, like if you're, for instance, treating an ankle and you feel the ankle's a really easy one because you can feel all the bony parts and all the meaty parts of the ankle and fine. The spot that's tender, that is where you're treating. 99 out of 100, you're treating that spot. So it depends on the area of the body, but it's always great to have imaging. I really like having the imaging. Plus, it also gives us an apples to apples comparison so that everyone can see what are you before the treatment and what are you after the treatment. And I always want there to be that positive effect on, I don't want to set something up for failure. I always want to set up an expectation that you're going to see an improvement from one treatment. And if you don't get an improvement from one treatment, then maybe save your money for something else. Um, in terms of how recent imaging needs to be, I like it to be within the last year. It's great if it's within the last year. If there's it can be longer than that as long as there's been no re-injuring. Like I have a patient that I talked to the other day and he's like, "Yeah, my shoulders it's his problem and he had an MRI from 2 years ago." Great, but he recently fell and on that shoulder and he not only did he re-injure it, he might have caused other damage. And I want to know exactly because I want to pinpoint and address and inject right in the areas that are harmed, so or painful or damaged. So yes, it's great to have imaging at least within the last year, maybe two, if there's been no re-injury to the site. That's going to really help me guide. So great, great questions though. Wonderful. Well, thanks for tuning in, everybody. If for those of you who are interested, tune in next month. I will send out in my newsletter the other link, and I look forward to connecting with you soon. Thanks for the great questions, and everyone have a great Thanksgiving. Take care.